So catheter ablation is a common procedure that we do for patients with heart rhythm disturbances. Essentially, the word catheter describes the little long tubes that we put into your heart through the little hole in the leg, through the vein. And the word ablation really describes controlled, localized destruction of heart muscle. And the reason we do catheter ablation is because patients often have heart rhythm problems that may be fixed if we burn away or freeze away or destroy small bits of heart muscle to treat the electrical short circuit in that person's heart. So it can be done for a number of different conditions, for example, atrial fibrillation, SVTs, atrial flutter, accessory pathways. Many of the problems that cause arrhythmias can be fixable with a catheter ablation procedure. Yeah, so there are different forms of catheter ablation depending on the specific arrhythmia. The common bit to the procedure is that patients will have little punctures or holes in the leg where we access the big vein in the leg and pass little long spaghetti tubes called catheters right up into the heart. And using some guidance system, we can put those catheters in the right place to record the electrical activity of the heart, sometimes to diagnose where the heart rhythm problem is coming from, and to treat it, to do the ablation by either burning or freezing little bits of heart muscle to get rid of the short circuit. There's a whole range of different durations depending on the specific type of arrhythmia. It often ranges between 2 and 4 hours on average, depending on some of the simpler arrhythmias. For example, atrial flutter will be quicker. Some of the more complex arrhythmias like atrial fibrillation, ventricular tachycardia might be on the longer end of the spectrum. And again, there is a mix of being awake and being asleep. Some of the more straightforward ones, like SVTs, we keep the patient awake and do it under local anesthesia. Atrial fibrillation, for example, we tend to do under general anesthesia. So it's a whole range. And catheter ablation just describes the technique, but it really depends on the specific problem you have and the specific problem we need to treat with the ablation. So we often say to patients that catheter ablation is a safe procedure that has low risks, but not zero risk. So although the complications are uncommon and rare, when I consult a patient and tell them about whether or not to go forward with it, I always remind them of the unlikely likelihood of something happening from the procedure. Again, the complications are very specific to the type of ablation and the type of arrhythmia that we're treating. Some procedures maybe carry a 1% chance of needing a pacemaker, but not all. On general, I say the serious complications are approximately 1 in 500. So about 0.2% of individuals who have it might suffer a serious complication like a small heart attack, small stroke, requiring emergency surgery. But it's very specific to the patient, very specific to the procedure itself. So you'll have to have that discussion with your cardiologist before the procedure. So again, this is variable depending on the specific type of catheter ablation. Normally, when people ask me how much time should I take off work, I say take 1 week off work at the minimum, and then see how you get on. Really, it's a keyhole procedure. And for many of the procedures that we do under local anesthetic, the patient leaves the hospital the same day. They walk out of the hospital. So it's not like having the chest cut open with open heart surgery. So the recovery is shorter because of the nature of this keyhole procedure. But even then, I say you need to take at least a week of work, or at least a week of any exercise, and then sort of take it day by day from there on in. If you recover very quickly, then you can go back to work after a week. If you're still not feeling up to it, then take a bit more time off. Yeah, so again, I keep coming back to the fact that the catheter ablation describes a generic procedure, and it depends on the specific arrhythmia we're fixing and the individual patient. So some of the common arrhythmias like SVTs or accessory pathways or atrial flutter, we quote a 90% success rate with a one-off procedure. So in about 10% of patients, there might be some recurrence in the future, but it's pretty good odds that 9 out of 10, the problem is fixed for good. Some of the other more difficult arrhythmias to fix, for example, atrial fibrillation, has about a 70% success rate. With one procedure, we can increase to around 80 to 85% with 2 procedures, but that isn't quite as good as some of the simpler arrhythmias. But again, it's all about the specific nature of the arrhythmia, the specific patient itself, and what other problems they have and how their heart's functioning. So very specific to each individual. There isn't a limit on the number of times one can have catheter ablation. You can have it as many times as you want. Of course, we wouldn't keep recommending having it again and again and again if it's not succeeding. On average, we'll probably have, for each specific arrhythmia, 2 attempts, maybe a third sometimes. But if the patient just will not respond despite a couple of ablations, then the cardiologist will often say, you can have as many as you want, but do you really want to have it? It's probably not going to benefit you. There might be risks that you are taking unnecessarily. So often around 2 is the average, but there is no real limit to the number. And there are some rare occasions when it's justified to have 5 or 6, but that would be very rare.